for joining us for our scheduled meeting this morning. I'm so rattled for being not able to log into Teams here that I've forgotten the date. But this is our scheduled meeting for the GMAC this morning, starting at 10 a.m. Connie, can you go ahead and do roll call?
Absolutely. Just want to remind everyone that this is being recorded. I believe there was a prompt that came up and alerted all of us as well. Amy Kelly.
Present.
Ali Caliendo.
Present.
Wonderful. Shayla Holmes.
Present.
Can you hear me?
I'm not sure who's speaking, but if whoever's speaking, I would like everyone to remain on mute.
Okay, this is Amy Kelly. I just want you identify that.
Oh, okay. Thank you, Amy.
I will mute now.
Stacy York.
Present.
Thank you. Lisa Janassi. Lisa Janassi.
Sorry, my mute wouldn't come off. Sorry.
Thank you. Leslie Biddleson.
Present.
Thank you. Shirley Trummel. Shirley Trummel. Amber Bosket.
Present.
Thank you. Fernando Serrano.
Present.
Thank you. Tom McCoy.
Present.
Thank you. Fred Schultz.
I'm present.
Thank you. And Diane Thorkelson.
Present.
Perfect. You have quorum.
Great, thank you. Let's move on to the second agenda item, which is the approval of the minutes. Connie, I actually had a question about this agenda item. There's like 4 or 5 minutes listed. It appeared that the attached minutes were actually, other than the October minutes, were actually from one of the subcommittees. Did you want us to approve those?
Sorry about that. The subcommittee minutes are included as there is not a second meeting for the minutes to be approved.
Okay, so can we just rely on the
subcommittee members?
Committee members that are here? Yeah, okay.
Yes.
So let's take these individually then. Let's start with a motion for the October minutes.
This is Fernando. I make a motion to accept.
This is Tom. I second the motion.
Any discussion? All right, hearing none. All those in favor of approval of the October 22nd minutes, say aye.
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 I apologize for the
Aye.
interruption. I got disconnected during the attendance. Rhonda Roth with Advocates to End Domestic Violence. Very sorry for the interruption.
Okay, can I ask everybody to put yourself on mute, please, if you're not speaking? So the motion approved.
Diane, I'm sorry. This is Connie. Cindy just reminded me we did not do item number 2.
Public comment. I apologize. I'm trying to run this meeting and I can't actually see my agenda at the moment. All right, let's take a step back to agenda item number 2 with public comment. Connie, I cannot see anything at this point in time, so if you can help me manage.
Absolutely.
So I would just like the public, anybody who has public comment, the floor is now open. I ask that you please refrain from being duplicative of any previous comments and limit your comments to 3 minutes. The floor is now open to public comment.
If we could use the raise hand feature and then we can call on each individual that may have raised their hand that might be a little more organized, and we'll be able to see that here, Diane.
Great, thank you.
Cindy, are you able to see if there's any public comment?
I don't see any public comment.
Okay. Then we can go ahead now and continue with item number 3, Chair.
Okay, back to the minutes. So we already had approval for the October 22nd minutes that passed unanimously. So let's move on now to the subcommittee minutes from February 25th. And this is the, hold on a second, I've finally been able to pull up my agenda. The Independent Living Subcommittee. So Independent Living Subcommittee members, I would like a motion for approval of the minutes from the 25th, or excuse me, February 25th, 2021 meeting.
And that was Fred Schultz and Tom McCoy in that meeting.
So one of us has to make a motion. I will do so. This is Tom McCoy.
Thank you, Tom. Is there a second?
Yeah, this is Fred Schultz. I'll second that.
Any questions or comments?
Excellent. Any discussion between Fred and Tom?
I got nothing.
All right, hearing
Same
none.
here.
Are you- all right. Yay or nay for approval of the minutes?
So approve.
Okay, great. Moving on to approval of the minutes.
Respite on March 1st.
Respite on March 1st. So any respite subcommittee members who are willing to motion for approval?
This is Lisa Janowski. I motion for approval of the minutes from March 1st.
A second, please.
Unfortunately, we only had one member in that particular meeting.
Can we move to approve just with Lisa's okay? Is that possible, Connie?
I think that any member can second it.
This is Leslie. I'll second.
Great. Any discussion? All right, all those in favor?
Aye.
Aye.
Any opposed? All right, motion passes unanimously. And
The last one, March 2nd, is positive behavior supports, and that was Leslie, Shayla, and Stacy.
thank you, Connie, for supporting me here.
No problem.
Leslie, Shayla, or Stacy, a motion for approval of the minutes from your subcommittee meeting.
This is Leslie. Oh, this is Leslie. So moved.
This is
Do I have a
Shayla. I'll second.
Any discussion? All right, all those in favor?
Aye.
Aye.
Any opposed? All right, motion passes unanimously. Okay, I think that's all of our minutes, right, Connie?
It is.
Okay, great. Okay, now we're getting to the reason why all of us are here today. We will move to agenda item number 4, which is our discussion and approval of the independent living funding recommendations from that subcommittee. This discussion will be led by Connie. I know that the agenda says Julietta. I believe Julietta is present and will be available for questions, but Connie is going to lead the discussion. Is that correct, Connie?
Absolutely. Thank you.
Okay, the
Thank
floor
you
is
very
yours.
much. Okay. All the members received an evaluation summary document. It's approximately 30 pages long. And it should also be in your meeting invite. For those of you observing the meeting, it is available on our website. And those that have an invitation, it's attached to the invitation as well. So we're going to start on this first page. I just want to do a real brief introduction, so not to take up too much time. The notice of funding opportunity, which we'll refer to as a NOFA, was released in early November of 2020. This is for the independent living, the respite, and then for the positive behavioral support as well. Was released in one NOFO. An amendment was done December 15th, 2020 as a result of the Q&A session that was open for 30 days. And the NOFO closed on January 15th of this year. Evaluation occurred through the working groups in February and March for evaluation. And what you see here are the results of those review committees. I just want to note that these 3 programs that we're discussing in the next couple items must target Nevadans with disabilities. This first program, Independent Living, is meant to fund programs that increase access to independent living services and support for the targeted population. As you can see in your material, we received 8 proposals totaling $762,000, or I'm sorry, $762,916. I can't say that for some reason. And then below, you'll see a list of each one of the proposals with the individual evaluator scores and the average of those scores. The graph that's there, or the graphic that's there, has been ranked according to the average score. The following pages, or actually, I'm sorry, over the next several pages, you're going to be able to review the abstract of the program, as well as any of the comments that were made during the review process. So we captured those there. I'm going to just move through each one of the proposals, pointing out where they're located. Starting on page 1 is proposal 1 from the ALS Association, the Nevada chapter. And if we move on to page 2, you can see that the abstract continues. And about halfway through the page is where you see that evaluation review. And so some of their comments were captured as well as we could do. So I'm not going to go through each one other than to name them. Proposal number 2 at the bottom of page 2 is Dignity Health, Helping Hands of Henderson. Moving on, we have proposal number 3 at the bottom of page 3 is the Families for Effective Autism Treatment of Southern Nevada. Proposal 4 was Nevada System of Higher Education. This is the Path to Independence. Proposal 5 is on page 7, the Lyon County Human Services. Proposal 6 was from the State of Nevada Department of Employment, Training, and Rehabilitation, their vocational rehabilitation program. Proposal 7 was Care Chest of Nevada. That is on page 9. And then the last one, proposal number 8, is on page 10, carrying us through to page 12, which contains the grant management unit recommendation for your consideration. We are recommending to fund proposals through the average score of 60%. In this particular category, this would be reflective of all proposals that have been submitted. We ask that the grant management unit is able to make technical adjustments to ensure that the budget and program parameters of the NOFO are within compliance. Funding as recommended will ensure regional coverage statewide for these services and will obligate all of the $550,000 in the Fund for Healthy Nevada, as well as $212,617 in Title 20 funding. This will occur annually for state fiscal year 22 and state fiscal year 23. And so that's our recommendation, Chair, if you want to lead the discussion with the members for our consideration and review and approval.
Sorry, I had muted myself. Let's open the floor to discussion from subcommittee members. If you would like to add anything to Connie's presentation. All right, hearing no discussion, I will entertain a motion for approval of the recommendations.
This is Leslie, so moved.
We have I hear a motion. Do I have a second?
This is Stacy York, and I'll second.
Any further discussion? All right, hearing none. All those in favor of approving the recommendations made under the independent living funding subcategory, please say aye.
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 Any opposed? Any abstentions?
Shayla Holmes, I abstain.
Thank you. All right, motion carries. Moving on to agenda item number 5, the respite subcategory. Connie, the floor is yours.
Thank you. Thank you. Thank you. In the same packet of materials, beginning on page 13, we're just going to move through it the same way. This is respite services. They are meant for, they are meant to improve the access and coordination for services to promote person and family-centered approach for care planning for caregivers and the support of them. This particular category received 9 proposals and totaled $1,140,936. As you can see, we had 4 reviewers on this committee. Done the same way, their scores are seen there and then averaged across to the orange column. Proposal number 1 was received from Family Support Council of Douglas County. And then as we continue through, we have ALS Association Nevada chapter on page 14 was proposal number 2. Proposal 3 is Nevada Rural Counties, the RSVP program or organization on page 15. Proposal 4 was Northern Nevada Rave on page 17. The following page, proposal 5 is Amplify Life. Lyon County Human Services is proposal number 6 on page 19. Proposal 7 on page 20 is the Foundation for Positively Kids. Proposal 8, Neighbor Network of Northern Nevada, is on page 21. And proposal 9, East Valley Family Services, on page 22. Our recommendation, as with the previous category, begins on page 23 at the bottom. The grant management unit is proposing to fund down again to the average score of 60% in this particular category. This would be reflective of the 7 first ranked proposals. We're requesting permission to complete technical adjustments to ensure that the budget and program parameters of the NOFO are within compliance. Funding as recommended will ensure regional coverage statewide and will obligate all of the $640,000 in the Fund for Healthy Nevada and $166,617 in Title 20 funding annually, again for state fiscal year 22 and 23. And that concludes our comments.
This is Diane Thorkelton. Thank you, Connie. Any further discussion from subcommittee members? All right, hearing none, I will entertain a motion for approval of the respite category.
This is Stacy York. I'll make a motion.
We have a motion on the floor. Do I hear a second?
I second.
Who gave the second, just for the record?
I think I heard somebody else, but this is Leslie and I'll second.
Okay, thank you, Leslie.
Yeah.
Any further discussion? All right, hearing none. All those in favor of approving the funding recommendations in the respite category, please say aye.
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 This is Fred Schultz. I need to abstain from vote.
Okay, hold on a second. Hold on a second, Fred. Any nays? And any abstention?
Yeah, this is Fred Schultz. I abstain.
This
Thank
is
you,
Shayla
Fred.
Holmes. I abstain.
What was that second one?
Shayla Holmes is abstaining as well.
Okay, thank you, Shayla. All right, motion carries with 2 abstentions. Moving on to agenda item number 6, positive behavior supports. I am actually going to abstain from this entire conversation. I've been really transparent about this in multiple meetings that I work directly and continuously with one of the applicants in this funding subcategory. So I'm going to hand over the chair to Stacy, and she will lead this discussion.
All righty. Stacy York, for the record, I'm going to hand it over to Connie to discuss the
Okay. Perfect. Thank you, Stacy. Before we get too far into this discussion, I wanted to just point out for the committee that the NOFO contained errors in this program description and was amended as part of the question and answer process and posted to our website on December 15th. Positive behavior support is a function-based approach to developing and employing individuals, or I'm sorry, deploying individual plans of support to the target population. As you can see, we received 4 applications totaling $756,189. The evaluators, we had 3 evaluators on these particular proposals. As with the other 2, I'm going to just call out each of the proposals received. Starting on page 25, proposal number 1 is Nevada System of Higher Education. The following page, page 26, is the proposal number 2 from Boys Town, Nevada in Las Vegas. Proposal 3 is United Citizens Foundation, also in Las Vegas. Proposal number 4, Clark County Department of Family Services on page 29. And I think that, yep, that is 4 proposals received. To be very transparent, or in the interest of transparency, I noted on the on page 30 in the center that during the review committee meeting, we had a public commenter that drew attention to the reviewers that about the December 20th amendment, and had stated that it did not appear that all proposals complied with the amendment. So I did want to make sure I notified this committee that after staff review, it was determined that 3 of the 4 proposals did not align with the amendment. On page 31, at the top, you can see the language that was included in that amendment. And just to conclude, the grant management recommendation is to fund proposals that are in alignment with the NOFO. In this category, this would be reflective of 1 proposal from the UNR Board of Regents. Grant management unit is requesting authority to complete technical adjustments to ensure budget and program parameters of the NOFO are in compliance. This funding as recommended will ensure statewide coverage and will obligate the entire $320,000 from the Fund for Healthy Nevada. And Stacy, that concludes our comments.
Okay. Does anybody from the subcommittee have any further discussion?
This is Shayla Holmes. I think I would just like to share that in our review of the applications, we did see benefit from all of the programs that were submitted, and that they were quality applications, but due to the NOFO amendment, I think we were pretty limited in our ability to make funding decisions, but I do just want to make the record show that the subcommittee did discuss each application and did identify strengths and positives for the state and the communities as far as what those programs would have offered.
And this is Leslie. I completely agree with Shayla's comments, and I think that Shayla is absolutely right that we have to put on the record that each of the applications were very well written and contain some strengths. Unfortunately, we won't be able to fund all of those, but I did also want to second Shayla's comments.
Thank you. And then can I get a motion for the recommendation?
Stacy, this is Allie. Before we do that, I just have one question that I think I might have missed. Can you clarify who made the decision that the 3 applications did not meet the requirements of the amendment?
Absolutely. This is Connie Lucido. For the record, it was staff review, so it was done by the grant management unit.
Thanks.
Mm-hmm.
This is, if we can go to the motion, this is Leslie, move to approve.
All right, and a second?
This is Shayla. I'll second that motion.
Any further discussion? All in favor?
Aye.
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 Any opposed? Any abstentions?
This is Diane Thorkelton. I'm abstaining.
All right, motion carries. And I think it's back to Diana for item number 7.
Great. This is Diane. Thank you, Stacy. We will move on to item number 7, the Wellness and Hunger Services. We will be given a presentation by Laura Urban. So Laura, I can't see you. Welcome. Thank you for being here today, and the floor is yours.
Thank you, Diane. I'm just going to pull up my PowerPoint on the screen really quick. All right, can everybody see my screen?
Yes.
Okay, thank you. Good morning, everyone. Thank you, Diane, for the introduction. For those of you who don't know me, my name is Laura Urban. I am the Food Security and Wellness Manager with the Office of Food Security within the Division of Public and Behavioral Health. Today, I'm going to be presenting a summary of the Wellness and Hunger Services Notice of Funding Opportunity, including its purpose, our review process, and the work group's final recommendations for your consideration today, along with the state coverage for the funding as defined by the Grants Management Unit. My meeting materials for this presentation are also included on the GMAC website, including this presentation, a map demonstrating the state coverage, as well as an abstract summary with the reviewer's comments from the meeting minutes. The Wellness and Hunger Services Awards are on a 2-year funding cycle with a total award of $2 million annually. The eligibility for this funding was both for public and private agencies in Nevada. This funding supports multiple goals of the 2018 Food Security Nevada's Plan for Action, which is the Nevada Council on Food Security's guiding plan, including aligning and enhancing collaboration efforts of state and non-state agencies to strengthen statewide food security strategies, supporting strategies to increase participation in federal and state nutrition programs, supporting client-centered strategies to increase access to nutrition programs and resources that address determinants of hunger, and also establish evaluation and reporting processes to enhance data collection to drive future strategies and track progress in addressing food insecurity. All proposed projects for this funding must align with the following objectives, including providing cost-effective services, and making them accessible, available, and responsive to the needs of individuals, families, and their communities, fostering a delivery system responsive to individuals' cultural diversity of the people and the community served, promoting a comprehensive and integrated system of services to promote self-sufficiency, and conducting a systematic evaluation of program activities to improve the effectiveness of the funds for Healthy Nevada monies. The budget funding requirements for this funding include that 50% of the requested funds must be allocated towards foods that support a healthy diet. Up to 40% of the funds could be used for case management and personnel. And lastly, up to 10% of the funded amount could be reimbursed for indirect costs. Based on feedback from the last funding cycle, the Office of Food Security and the Grants Management Unit expanded the review committee to ensure that the group was comprised of subject matter experts and individuals that had experience in nutrition and/or community services and programming. The review committee was comprised of 6 members, including 3 Grants Management Advisory Committee members, representation from the Office of Food Security, myself, representation from the Women and Infants Children's Program and the Nevada Division of Aging and Disability Services. The committee met 5 times to discuss 17 proposals and to develop recommendations. For those 17 proposals, the total requested amount was over $4.1 million, more than double than what was available. Each application was reviewed by 3 committee members, and each score and their average scores are included here on the slide. Again, this is also available on the GMAC website. The ranking for each applicant based on their score average is outlined on this slide. As you can see, the group had their work cut out for them. Once the committee had the average scores, the committee looked at the various grant requirements to help inform and guide the recommendation. Ultimately, the committee decided to disqualify Money Management International and Jewish Family Services for lack of signed partner agreements. The issue of the written agreements was discussed in length by the group, and the Office of Food Security and the Chronic Disease Prevention and Health Promotion Section did consult with our Deputy Attorney General to ensure that we took appropriate action. The Notice of Funding Opportunity, or the NOFO, did require that applicants include MOUs. The frequently asked questions, which were issued after the NOFO, further defined the MOU requirement to include any signed agreement specific to the proposed project. The committee also decided to disqualify Catholic Charities of Southern Nevada, as their proposal only served older Nevadans, and it did also specify in the NOFO that these initiatives must serve Nevadans of all ages. This slide includes the final recommendation approved by the committee. 5 of the 6 committee members voted in favor of this recommendation. The committee recommends that the top 2 applicants, 3 Square Food Bank and the Food Bank of Northern Nevada, be funded in full. The committee also recommends that the following 7 top scoring applicants be funded at 90% of their total requested amount, including United Communities Coalition, Washoe County Human Services, Dignity Health, Northern Nevada Dream Center, UNR, Communities in Schools, and Desert Springs Methodist Church. Due to the high request amount, the group recommended that Catholic Charities of Northern Nevada be funded at 90% of half of their total request, contingent on a required focus on rural counties not being served through the other subawardees being funded through Funds for Healthy Nevada, including Lander and White Pine counties. Following these recommendations, $81,197 remained unallocated. This was not sufficient to meaningfully fund remaining proposals, so the committee recommends that the remaining $81,197 be added to 3 Square Food Bank's total award, contingent on serving USDA food deserts in Southern Nevada. 3 Square's proposal already included Sandy Valley, and in addition to ensuring that this community receives funding, the committee also recommends that 3 Square expand their proposal to include the community of Bunkerville. The remaining proposals outlined here were already covered in other proposals. Lastly, after the 5th and final meeting, the Office of Food Security and the Chronic Disease Prevention and Health Promotion section were approached by the Grants Management Unit, offering an additional $200,000 in Title 20 funds to support hunger and wellness services. So with that, the Office of Food Security and the Chronic Disease Prevention and Health Promotion section recommends that these additional monies be allocated to Catholic Charities of Northern Nevada, bringing their total award to $490,558, which is about 71% of their original requested amount. As requested by the Director of Health and Human Services, we do have regional coverage based on the existing definition. We do acknowledge with the minor decrease in funding for the applicants that coverage per county may change. And as I mentioned earlier in the presentation, a map of this coverage is included in your meeting packet. Thank you all for your time today. I'm happy to take any questions or comments at this time. And I know we also have some members that served on the work group on the committee as well, so they can speak to our process. Thank you.
Thank you, Laura. I finally overcame my spinning wheel of death. Don't exactly know what was happening there. Anyways, thank you, Laura. I can speak as a member of the subcommittee. I think this is the 3rd time I have participated on the Wellness and Hunger Group, and it's usually a pretty straightforward discussion. We had hours and hours and hours of discussion this round. Some very, very passionate and informative discussion around the hunger needs of our state. So I want to thank all of the subcommittee members that are present and all those who aren't present for your diligent commitment to the process. Any other discussion from committee members?
Yes, so this is Amber Bosket, and I do have a comment. Can everyone hear me? Awesome. So just to clarify, I'm not sure that this was covered in the presentation just now, but our subcommittee actually took 2 votes to get to our recommendation. The initial vote was how to distribute the majority of the funds, and the second vote was how to distribute that remaining 81,000 of the 2 million that was left over after initial distribution recommendations. And so when Laura did mention that 5 out of 6 applicants voted for the recommendations, I just wanted to clarify there were 2 votes, and I did vote that the main distribution go as the entire committee recommended. However, I did not vote with our subcommittee on that distribution of the 81,000 for the following reasons. So the recommendation to give the 81,000 to 3 Square was interesting to me because it technically funds 3 Square above 100%. It funds about 120%, and so it's beyond what they were originally asking. And the requirement of asking them to, support the food deserts and reach out to places like Sandy Valley and Bunkerville is interesting because both of those places actually submitted applications on their own, and this is the point that I was trying to make. Ultimately, I think that the remaining 81,000 that is available in our recommendation is an opportunity to truly meet regional coverage by funding the Keystone Enrichment Foundation proposal, which is located in Sandy Valley. It's very important for us to fund this proposal because they have truly special circumstances in that although they are classified as serving Clark County, they are actually rural and located well outside of urban Southern Nevada, and they are in a place with no services. Specifically, they are in a low-income, low-access USDA food desert within a desert, and they are 80 miles round trip from the nearest grocery store. And they also have no restaurant, no medical facilities, and no food resources. So something I want to point out about Clark County is that it has been identified to our committee that it is the single county in Nevada where food insecurity skyrocketed the most since last year's economic shutdowns. And to be specific, the food insecurity in Clark County has increased by 57%, which is nearly double the rate of increases seen by any other county in Nevada. So getting these resources to this community is imperative. And as for the proposal from Keystone Enrichment Foundation in Sandy Valley, this proposal received a score that was just 3 points lower than the threshold set by the committee for funding. And that's why it was not recommended for funding. But I think that for all of the reasons I've highlighted, that this proposal should absolutely be funded for the full amount of $26,819 that they have requested. You'll notice that's a very small amount. Our subcommittee is recommending instead of that, as I've already mentioned, to give the extra money to 3 Square and just require that they help Sandy Valley. But to me, it just makes total sense to fund that $26,000 straight directly to the Sandy Valley proposal, as they can provide their own resources in a far more efficient manner than requiring 3 Square's assistance. I just want to note that 3 Square is 120 miles round trip from Sandy Valley. And so again, getting the resources directly to Sandy Valley is the best way to assist the community. 3 Square will be supporting Sandy Valley, and it was part of Sandy Valley's proposal for 3 Square to do so. I think that should continue as is and as they had planned and decided. And so that is the recommendation that I did want to make to the entire committee as a whole. I also served on the Conservation District of Southern Nevada for a little while there, and that is why I'm so familiar with the different communities in Southern Nevada. All of our, we've got our urban jurisdictions, but we have our rurals as well. So thank you.
This is Amy Kelly. Can you hear me?
Yes, Amy, go ahead.
I just wanted to acknowledge 2 things. Number one, I really, really appreciate the criteria that staff recommended in terms of the 60% threshold that thus far has been consistent for all funding recommendations. And simultaneously, I would like, and I am not on this committee, but I really would like to endorse Amber's recommendation to make an exception for Sandy Valley. And I think what she's saying about, having a community-based organization providing those services that has the capacity is very relevant. So I I just want to voice my support for her recommendation, and I know it makes an exception to the 60% threshold that staff has recommended, but I think it's a reasonable exception. And that's all. Thank you.
This is Diane. As a member of the subcommittee, this is the point that we struggled with for hours, literally. We all really agreed with Amber in terms of the unique needs to Sandy Valley, although I don't think that they are completely unique. I think there's lots of other communities across our state who are very, very isolated without, and our food deserts, without grocery stores, without medical care. I personally have family members that live in such communities up here in Northern Nevada. Our concern was that if we made an exception for the Keystone project, that there would be unfunded applicants that scored higher than the Keystone project. We did not like the precedent that set. We were keeping in mind the historical context of all of this, the feedback that we have gotten as the GMAC from applicants across the years about having a tendency to not follow our own rules, and the frustration that folks feel about that as they're applying for our process. The bulk of our committee felt that it was important that we honor the rules that we had set in the NOFO, honor the funding thresholds and the score thresholds that we had decided on. Our ways to potentially come to a compromise was to provide that extra money to 3 Square with the asterisk to that money that they have got to serve communities such as Sandy Valley and Bunkerville. Those, again, food desert, highly isolated communities within our state.
This is Amber Basket. So just a couple comments in addition to those by Diane. I just wanted to highlight that it's true that there are other committee or other places across the state and counties and locations that don't have, services. However, what's unique about Sandy Valley is that they specifically submitted a proposal. So although there are places that need funding, again, that are in food deserts that don't have resources, Sandy Valley is making this stride in this effort to request funding specifically for their community. And they're actually going to do this to expand what they started a couple years ago. And that's a fantastic venture. Also, I want to highlight that the 2 unfunded projects that received a score higher than Sandy Valley out of our list was the Just One project and then the Reno application as well. However, the reason that this exception in funding recommendation, the reason I'm making it is because so our committee set the threshold, right? And it's not at 60%. They actually set it at, I think, 83%. And so that means that anything below 83% in our committee did not get funding. So the Just One project had like an 82.63, I think, and then the Reno project just below that. And then Keystone fell right below that. So they were the third that was not funded. Now, both the Just One project and the Reno project falling below that threshold asked for, well over the $81,000 that is left in the budget. Also, they both serve the urban areas that are already being funded through other proposals. So the recommendation to make the special exception and fund Sandy Valley is because they were the next in line. They also, the amount that they were requesting for the $26,000 is well below the $81,000 that's remaining in additional funds. And they serve an area that no other application in our group of applications served.
This is Diane Thorgelton. As you can see, this is where our committee got stuck for hours and hours and hours. Do I hear a motion? You have some competing proposals on the discussion table.
This is Leslie. I'd like to make a motion to fund the top ranked without the 81,000 at this point, so we can approve that, and then look at what we want to do with that $81,000. It seems to be a tough decision. So I move to fund follow the recommendations for the funding minus the 81 whatever.
This is Ally.
This is Amy Kelly. Okay.
Sorry, Amy, go ahead.
Kelly. No, this is Amy Kelly. I second Leslie Biddleson's motion.
All right, any discussion on this motion? All right, hearing none. All those in favor?
Aye. Aye. Aye.
Any opposed? Any abstentions?
Lisa Janassi, I abstain. I'm part of, we have a grant.
Thank you. All right, motion carries. The approval of everything up to the $81,000 in contention here. So, Connie, can we continue to discuss and decide on that 81, or does that have to be a separate agenda item?
No, it would be included in the agenda
in this
item.
agenda item. Okay. All right. I will open the floor to discussion. We've heard from Amber that she would like 26 and change of that $81,000 to go to the Keystone project. Amber, did you want to say anything else about that?
I think I've made all my comments, and so when it's time, I would like to make a motion.
So are you making a motion?
Yes, so I will make a motion that of the remaining roughly 81,000 that is available, that we fund the Keystone Enrichment Foundation project at their full requested amount of $26,819.
Do I have a second?
This is Leslie, and I will second, but can I make a comment when we're done with that?
Yes, ma'am. Discussion.
Thank you. Being the juvenile justice representative, part of my job is to visit all of the jails and police stations all across the state. And having been to the rurals, you know, I've been everywhere. And I really agree that we need to include the rurals as much as possible. That's my first comment. My second comment is for those of us who have been on this committee for a while, we talk a lot about those areas that are unfunded and those areas of need. I'm not a big proponent of making exceptions. However, I think that the fact that this area did submit a proposal, usually we don't get proposals for our rural areas. So like I said, I want to put on the record that I'm not for exceptions in general. However, I think this is a good exception to make. I want to say that it is a hard decision to make, and I appreciate the committee's due diligence and struggle, because I was not a part of the committee, but in listening to both sides, I would like to support Amber's request, so I second. Thank you.
Any other discussion?
This is Amy Kelly. I would like to make an additional comment, and again, noting I am not on this subcommittee. And I echo what Leslie has said. We, I think, have to, as a person on the Child Abuse Committee, we are always trying to calculate for capacity of proposals we're getting from frontier and rural communities. And yes, I know we are making an exception here, but I think as this is my second round of doing these evaluations, I think something that's been very alive in our conversation is how are we ensuring that equitable funding is going to our rural and frontier communities, and who is the best organization to provide those services. And I feel like we've had some consistency or at least some representation that, you know, organizations that are by, for, and of the community know the community best. So again, I I would support this proposal and that Amber has made, and just want to again echo some of the sentiments that Leslie has articulated. Thank you.
Thank you. Any other discussion?
Yes, this is Ali Caliendo, and I don't know if I missed this, but the discussion that you all had in the subcommittee about asking 3 Square to reach out to these rural areas, was that outside the scope of what they wrote in their recommendation? Would you be asking them to do something that they didn't put in their proposal?
This is Amber Bosket. Yes, that would be my understanding.
Amber, I think this is Diane. I believe you're incorrect. I believe that they actually called out Sandy Valley as one of the first communities that they were going to be working with in their rural efforts.
This
Laura,
is Amber.
can you?
But she's referring to the scope. Yes, of course, the 3 Square is going to assist Sandy Valley. If you read the Keystone Foundation proposal, one of their key partner is 3 Square. So that was already established that they will be helping Sandy Valley. But Sandy Valley submitted the proposal. So going to give the funding to 3 Square instead of Sandy Valley is outside of the scope of the proposal, and specifically in the manner in which 3 Square submitted it.
Oh, no.
This is Ali, and I'd say I'm in support of funding them, and I would just be a little bit concerned that we're asking an agency to do something different than the way they wrote it to solve this.
Sorry, sweet girl. Yes.
This is Laura Urban for the record. I'm just chiming in to clarify that 3 Square did not mention Keystone in their proposal and did say that they were going to be working with Sandy Valley. And I can confirm that organization shortly.
Welcome to the audio conferencing center. Please enter a What?
I'm not done. What?
I'm in a circle. If you're the meeting organizer.
Anyway. This is Leslie. So can we kind of amend the motion that Amber presented to provide the $26,000 to roughly, excuse me, I don't know the exact amount, to the Keystone, and the remaining amount out of the roughly 81 as recommended to the I'm getting the grantees mixed up. I'm sorry. So the Keystone Project Fund at 26 roughly, and then the 3 Squares, the remaining amount. So I would like to present an amended motion to make sure that we are covering those rurals as best as we can.
This is Amber. I second that motion.
This is Connie Lucido for the record. Stacy, until we get Diane back, do you mind continuing the motion?
No, not at all. So we had a motion and a second. Do we have any further discussion?
Sorry.
I just want to clarify. This is Amy. Oh, go ahead.
I'm sorry. This is Cindy. So Miss Bosket motioned that the Keystone was funded at the full amount, and Leslie seconded that. And then I'm just trying to keep this straight in the notes. And then
Leslie amended and said, because we have 81 and some change to allocate. So my amended motion is to fund the roughly 26 to Keystone and whatever remaining of that roughly 81 to 3
Square.
Thank
that was
you.
Correct.
Leslie, I'm sorry, excuse me, this is Amy Kelly. With absolute respect, aren't we in the situation again that we are then funding 3 Square over their 100% of funding requests? And what is the scope of work? What is the expectation around the scope of work if we're funding them in excess of 100% of their requests and we have Keystone covering Sandy Valley? So I feel like I need that clarification. I feel like
So
I'm
this is
not
Amber
clear.
Bosket.
So-
I have a recommendation then that may suffice, because I do actually agree with you, Amy, those points that you're bringing up.
Yeah.
And yes, it would still be overfunding the 3-square application at above 100%. In the recommendation that our subcommittee made when they recommended to fund the rurals, they also recommended to fund for 3-square to try and assist Bunkerville. On that note, there was one additional and only one additional proposal submitted to our committee, which was one from the city of Mesquite. Now, I think they were requesting about $150,000 roughly dollars, which exceeded, and they also scored the lowest. However, in the best interest of maybe trying to reach, they serve Bunkerville, maybe in the best interest, since they still, I think they received a 77. It's not like that's a super low score. We could make an additional recommendation for that remaining roughly $55,000 to fund that last proposal for the city of Mesquite at roughly, 33% of what they were asking for. And then at that point, they would be able to initiate their program, and they do serve Bunkerville. So I make that motion.
So Amber,
This is
let
Connie.
me, this is a quick question. This is Amy Kelly. Are there any concerns with their proposal, and where are they in the ranking? Because thus far we have like a very logical justification of why we are funding Keystone, right? So
Right.
are there any, are we jumping, down the list too far, or where's the?
So Mesquite
I
came right
understand-
under Keystone.
Okay. So we're placing the emphasis on like place-based providers.
That would
So I
be
just want to make
correct.
sure that we're consistent and rational with like how we are thinking about this. So that sounds completely appropriate to me.
This is Connie Lucido for the record. I just want to clarify for the committee. Currently, we have an amended second to funding
Keystone.
the Keystone projects. Thank you very much. And then the remainder going to 3-square. So we'll need to either vote on that or amend that motion.
Okay, so this is Amber Bosket, and I will amend the motion. And my motion is to fund the Keystone Enrichment Foundation at the full amount of $26,819, and then to give the remaining funds of the 81,000, which is going to be roughly 55,000 left over, to fund the Mesquite proposal, which continues to reach a location outside of urban Southern Nevada, and will reach Bunkerville as well. And that will fund them at roughly 33% of their ask.
This is Amy Kelly, and I second Amber's motion.
I believe that the order, this is Connie for the record, I believe that Leslie would need to second that, as it's been back and forth between Amber and Leslie.
Oh, sorry,
Unless-
So the amended motion is to fund at 26,000 the Keystone, and then roughly 30% of the area that serves Mesquite and Bunkerville. Is that what I'm hearing? That's the amended motion.
Yes, with the remaining 55,000.
Okay.
Yes.
Okay, this is Leslie, and I will second the motion.
All right, and before we get into any further discussion, please make sure to say your name before speaking. So any further discussion? All in favor?
Aye.
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 Any opposed? Any abstentions?
Lisa Janowski, I abstain.
All right, and motion passes. All right.
This is
so
Diane. Stacy,
Oh.
this is Diane.
Hi.
I apologize. I am having tech meltdown at my house. I also believe that you guys probably heard me utter some curse words there a few minutes ago, that I thought my computer was crashing, but apparently was still on. I was still mic'd, so I apologize for that. Okay, so I have no idea what I just missed.
This is Leslie, and Diane, I feel your pain. I curse at my computer quite often. And I've been booted out of meetings more than once. But just to update you, we made a motion, another amended motion to fund Miss Keystone at the roughly 26,000, and then to fund 30% of the applicant that covers Mesquite and Bunkerville, in order to make sure that we are addressing those rural areas. So that's what happened, and the motion passed.
Okay, I would, if we can for the record show that my vote for that would have been no. Back to the reasons that I stated earlier, that I think, although I agree, at my bleeding heart liberal social work self completely agrees with all of the arguments, but I feel like we need to honor the work that we've tried to do with the GMAC to be consistent in our rules. So that is why my vote would have been no. And it appears that I'm back on screen. So I'm gonna hope that that works.
Okay. Again, I apologize for all of my technical struggles today. Teams is not my favorite app, I will readily admit. Do we need to take care of the $200,000 amount that Connie was potentially giving us from the Title 20 money?
This is Connie Lucido for the record. My understanding is that was approved in your first.
Okay.
Motion.
Leslie, was that your intention behind that first motion?
Yes, that was my intention behind the first motion.
Great. Perfect. So then I think we're done with wellness. Is that correct? All right, moving on to agenda item number 8, community-based child abuse and prevention and the Children's Trust Fund. Kelsey, if you are present, the floor is yours.
Welcome, everyone. Sorry, I was trying to get on mute and camera on and get ready. For the record, my name is Kelsey McCann-Navarro. I am the chief of the Grants Management Unit here at the Division of Child and Family Services. We are currently overseeing the community-based child abuse prevention funding as well as the Children's Trust Fund. And then Cindy, do you have my PowerPoint? For the record, there is a PowerPoint presentation as well as an overview of the evaluation committee comments that is on the GMAC website.
I'm trying to share that.
No worries.
Can you see it?
Yeah, if you could just make it bigger.
How about now?
We see it. It's half a screen.
Hang on. How about now?
There we go.
Yes.
Okay. First time.
Perfect. No, you're doing great, Cindy. Thank you. I appreciate it. If you could just go to the third slide. Just a quick overview of the community-based child abuse prevention. It supports, this is a federal funding, it supports community-based efforts to develop, operate, expand, enhance, and coordinate initiatives, programs, and activities to prevent child abuse and neglect. And if you go to the next slide, please. The Children's Trust Fund is general funded, it's state funding. The funding is provided to programs that support community-based efforts to prevent child abuse and neglect, provide parenting education, self-protection education for children, and coordination of resources and activities to strengthen and support families. Next slide, please. So the CBCAP and the CTF funding priorities, it is for primary and secondary prevention. That means that primary prevention is programs and strategies which are available to all families. And secondary prevention is targeted for children and families at risk of abuse or neglect. Next slide. Just an overview of our notice of funding opportunity. The funding opportunity was released on January 29th, with the deadline for submission was March 5th. The available funding total was $1,068,278. Of that, it was comprised of the community-based child abuse prevention funding, which was $140,000, and the Children's Trust Fund funding, which was $928,278. We received 27 total applications, totaling roughly $2.9 million. There were 7 applications specific for the CBCAP funding and 23 applications specific for the CTF. There were some agencies that requested both funding sources, which why it adds up to 30 as opposed to 27. But we did review all 27 applications. Cindy, next slide. There were 6 total reviewers. We had 3 GMAC subcommittee members and then 3 other reviewers that had experience with child abuse prevention or grant management. Each reviewer scored either 8 or 9 applications to award the funding. We had 2 meetings, one to discuss the evaluation summary, which is the other attachment, with the evaluation committee kind of explained all of the comments that were made regarding each application. And then we had a second meeting to discuss the application scores, and the committee recommended that DCFS make the funding recommendations with an emphasis on making sure we fund frontier agencies. Next slide. This is a ranking of all of the applications and scores. DCFS, you'll see in the first column there is a reviewer score and then GMU score. That is a score that is, it was in the NOFO application. It has to do with past performance with the grant management unit here at DCFS and their funding request. So GMU will score all those applications and for the total score, which is ranked. And then the evaluator recommendations, that was just if what the evaluators were recommending, if they got the agency get full funding or partial funding or no funding. Unfortunately, there isn't enough funding to fund everybody at full. So the next slide, if you look, we kind of broke it out. So we broke it out into each different subcategories. So the child self-protection training, parenting education, respite, and case management and home visitation. Each has its own separate funding recommendation. So you'll kind of see on this slide the area that they're proposing to serve, the agency proposed services, their total score, what they had requested the amount, and then we did a multiplier, which means what we just took over the total number of points divided by how many they had to get a multiplier, and then we just kind of made cuts that way. New agencies were funded at $45,000 to get started. And they'll kind of go from there. So each slide, if you go down to the next one, Cindy, is this one's case management, and then respite, and then go to the parent education. So parent education was the most applications we received were for parent education, and so we broke it out for Clark County, Washoe, and then the rurals. So there's a separate chart for each area, and then this is Washoe. And then there's 2 slides for the rurals. We had a lot of applications for the rural counties, and so you'll kind of see those on those 2 slides. If you go to the next slide, this is our snapshot of the funding recommendations. It's this slide and the next slide. I wanted to make it big enough so that everybody could see it. And so you'll see what the funding recommendations were to the $1,068,278. By funding as recommended, there would be regional coverage throughout the state. So that's a lot of information all thrown at you at once. Just let me know if you have any questions.
Thank you, Kelsey. Any questions from the committee members?
Yeah, this is Leslie. Kelsey, can I ask a question on what factors did you and the committee use to determine partial funding? You know, because you have some recommendations for full funding, partial, and no funding. So I was just wondering what kind of factors factored into the recommendation of partial funding.
So that was determined. So the partial versus full was determined by the evaluators, and then DCFS made the decision to internally to fund everybody that we could as a partial, so that we could ensure that services were provided statewide and also within the certain subcategories. So no one really got their full amount. Everybody got partial funding or they got no funding. So instead of taking it from a, here at DCFS, we determined instead of taking it from a top all the way down based on scores for everybody to get funded, because there were so many subcategories, that we did it based on an allocation based on their total score.
And based on region or area?
Yes.
Okay, thank you.
Any other questions or comments?
This is Cindy, just reminding everyone to please say your name. I know it's tedious, but later when I transcribe this, then I'll know who you are.
Sorry, Cindy, this is Diane Thorkeldson. Any other questions or comments? All right, I will entertain a motion for approval.
This is Leslie, move to approve as recommended.
This is Fernando, I'd second.
Excellent. Any more discussion? All those in favor, please say aye.
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 Any opposed? Any abstentions?
This is Shayla Holmes and I abstain.
Lisa Janassi, I abstain.
All right, motion carries with 2 abstentions. Moving on to, was that both of your categories, Kelsey? Or do we need to talk about?
Who was the other abstention? Sorry.
Shayla Holmes and Lisa Janassi.
We can barely hear you, just to let you know.
Kelsey, was that both of your funding categories?
Yeah, this is Kelsey for the record. Yes, that was for both funding categories.
Okay,
we combined them.
All right, I just wanted to make sure. All right, we are nearing the end. Other information items. I know that the tobacco subcategory was inadvertently excluded from this agenda, and so we will need to find another meeting time in the relative near future to address the tobacco subcategory. Connie, do you want to just talk about how we might move that forward?
This is Connie Lucido for the record. We will send a doodle poll to our members. We are looking at sometime in the next 2 weeks so that agencies can begin the subaward negotiation process no later than May 1st. We have to have those awards in place by July 1st, so that will give the agency 60 days. So be looking in email for a doodle poll.
Great, thank you. And is it only that's the only subcategory left, correct? Is tobacco?
Correct.
Okay,
Correct.
perfect. All right, any other business commission members might wanna, any other information items?
This is Leslie. Can I make a comment? I guess it's other business. I just want to commend the grants management unit for the incredible documents provided to us as committee members. You know, I found them to be extremely helpful. I read every word on that 31-page document, and I found that to be really, really, really helpful. I would also like to comment on the reviewers of the other committees. Your positives and negatives are always extremely helpful. So, you know, I know we have a hard job with reviewing all of these applications, but the grantees and the applicants have a hard job of pounding a square peg in a round hole with trying to submit applications that are comprehensive and meet all of the requirements as required. But my biggest kudos to the grants management unit. Incredible documents, much improved from the last review cycle to this review cycle. So thank you so much.
This is Diane Thorkelton. I would echo all of those sentiments. Any other?
Diane, this is Amy Kelly. Can you hear me?
Yes, we can.
Yeah,
Thank you, Amy.
I would just like to reinforce what Leslie and you have said. I think the process and the supporting documents were just a really graduated, elevated experience and criteria, and a huge advancement over our work last year. So huge thanks to staff especially.
Yeah, Diane, this is Fernando.
Hi, Fernando.
I would just like to say the same thing. All the work involved in this process with the GMAC staff. We know these documents just don't magically appear. There's a substantial amount of work goes into writing, compiling. I was on the child abuse neglect subcommittee, so likewise, Kelsey McCann Navarro, DCFS staff, our own staff who was partners in that process for those grants that we reviewed. Everything just went off smoothly. Communications were always just spot on, and just appreciate the support of staff as we were reviewing the various proposals.
Thank you. Anybody else? This is Diane, for the record. Again, this is Diane for the record. I just want to again extend my personal apologies for all of my tech difficulties and whatever you may have seen or heard while I was having a particularly frustrating chair of this group minute blended with tech meltdown blended with homeschooling. So I will be very glad when life returns to the before times, whenever that might be. So let's move on to the next agenda item, which is public comment. I will open the floor to public comment. I ask you to remember to please avoid being duplicative of previous comments and to try to limit your comments to 3 minutes. I can see everybody this time, I think.
This is Connie Lucido for the record. I apologize for interrupting. If we could just use the raise hand feature. So if there are comments, we can call them, might be a little bit more organized.
Is there any, Connie, this is Diane. I might have to rely on you. I'm not sure I can see everything.
This is Connie. I'm not seeing any raised hands.
Okay.
Maybe we have folks that can't raise their hand. Maybe you're not able to find it. So go ahead and just unmute. I just don't want to miss anyone if there's a public comment.
Oh, I am seeing a raised hand from Corinne.
Perfect.
Hi, this is Corinne with the Northern Nevada Rave Family Foundation, and I just had a question. I know I see on the FHN that the average score of 60%. Is there a spot that says what we have been awarded?
This is Connie for the record. Corinne, are you referring to independent living and respite?
Yes.
It would be there, the dollar amounts listed in the material.
On for respite then on page.
And Corinne, we can take this offline.
Okay.
The public comment is meant to make comment statement.
Okay. Thank you.
Any other public comment? All right, I am not seeing any. Connie, are you seeing any?
I do not. I always
No.
like to ask Cindy though.
Okay.
Nope, I don't see any.
Perfect.
All right, hearing no public comment, we will move to our final agenda item. Any final announcements, Connie?
We do not have any. We will, other than each division with the funding will be in touch with all applicants, funded or not funded.
Great, thank you. Then I will entertain a motion to adjourn.
This is Leslie, so moved.
Is there a second?
Second.
Stacy.
All right. Meeting adjourned at about 11:30, 11:29, according to my computer clock. Thank you, everybody. Look for that
Thank
doodle
you.
poll.